cataract surgery is one of the most common surgeries. So, from your perspective, what are the most common complications that patients may face after cataract surgery?
Great question. And actually, patients ask me this all the time. As we prepare, they say, what do I have to face? Well, you have the dreaded complications that you just mentioned as a side, but they're just so rare, like infection. How often does that happen? Retinal detachment, lens dislocation. I think ruptured capsule is, as a surgeon, that's probably the complication that a lot of surgeons dread, because if that capsule ruptures during surgery, it means more surgery. It means more risk of complications later down the road, like cystoid macular edema or lens dislocation. That capsule rupture rate, I think in some studies, is up to as high as 4% across the board, which is pretty high. But when you look at patients from a general point of view, some people say, I had a complication, my cataract surgery went bad. And you look, it was a perfect surgery, a perfect lens. So when people say complication, I think it's perspective. As a surgeon, we think about really bad problems like iris prolapse, like capsule rupture. From a patient though, in their mind, if they have macular disease and it wasn't told to them beforehand, they weren't counseled it beforehand, that in their mind is a complication. That's why we try so hard beforehand to diagnose all this, to avoid all those pitfalls. We have to counsel them through any issues if there is a complication.